Computed tomography, or CT for short, is a medical scan that uses X-rays to create cross-sectional pictures of the body. Upon arrival to the radiology department, please report to the counter staff who will direct you to the correct room. Please note, depending on the type of CT scan, you may be required to arrive 2 hours earlier than your appointed time and fast for up to 6 hours. Our dedicated nurses would ask you questions regarding your medical history. Please inform the nurse if you suffer from asthma, diabetes, or any other allergies. Afterwards, you may be required to change into an X-ray gown. For female patients below the age of 55, please inform the nurse if there is any chance you may be pregnant. If contrast media is required, our nurses will give you an IV cannula and you may be asked to drink oral contrast prior to the scan. Before the scan, the radiographer may again ask you about your medical history, and for female patients under the age of 55, they may ask you about your pregnancy status. During the scan, you would be asked to lie down on the scan table, and the radiographer would give you a brief explanation of the scan. If contrast media is required, you might experience a hot or cold flush in your body and a metallic taste in your mouth. Breathing instructions may be given, and it is important to remain still during the scan. After the scan, the radiographer would help you to remove the needle. After the needle has been removed, please apply pressure to stop the bleeding. You can eat and drink as normal and resume your normal daily activities. If you are diabetic taking metformin, do not take your metformin for the next 2 days. You may change back into your attire. The results from the scan will be discussed with you at your next appointment.